subscribed to join this particular discussion, automatically you waive your rights to not be recorded, so to speak. So we will have this session recorded, and later on we'll share the recordings with you so that you can also share it across your networks. I know everybody will not be able to join in, but of course it's always good to have a point of reference. We're going to be having like a full house later on. Of course, ideally the dissemination of this particular report is the reason why we're hosting this particular 1.5 hour deliberations. And I was saying, when it comes to the Anglophone and Lusophone Africa, to better tackle HIV, TB, and malaria, we tend to, go back and take a step just to figure out what are the needs, what's going on ground. And that's why we're also, sharing the findings that we had. So without wasting more time, early this year, ENASO conducted a community learning needs and assessment to identify key knowledge gaps and training needed. And we'll be hosting this particular 1.5 hour discussion so that we can now tell you what were the findings, what were the gaps, and what would be the key steps after this dissemination. And that's why you come in. We'd like to also bring in your expertise. So we'll have a session where we'd want your feedback, so that we can figure out what would be the next step after disseminating this particular report. Yeah, so we can go to the next session just to get a bit of house rules in order. Maybe next slide, please. So welcome all. The good thing is we do have our able translator, Rui, on the other side. And just to let you know that we're translating English to Portuguese. There is an icon that you can see with the globe sign. So if you click on it, you will get the Portuguese button that you can select. Always remember to mute off the original audio so that you can get better reception. Next slide, please. I'm sure somebody's controlling the slides. I think it's Glory. If you don't mind, would you kind of just go to the next slide, Glory? Perfect. Now, this is just a few rules on how we're going to proceed with the 1.5 hours. Of course, it's a webinar. We're trying to learn, but we're always requesting that you be on mute because automatically you're unmuted. Rename your account because we'd want to, refer to you in the appropriate names, so you can rename your account. Do have your name, your organization. You might even add your country if you have enough space. You've subscribed, as I mentioned, so hence, we're going to be recording the session. We're assuming that it will be your full consent for us to record it. Use the chat option for Q&A and comments. We'd like to engage because we want feedback, not only after the presentation and we have the comment section, but we'd also want it to be super engaging as we go. So please feel free to utilize the chat option. Use the electronic hand to request a chance. You might want to, comment about something, ask a question to get some clarity, or you just have a burning question that you cannot wait. We would request that you also use your electronic hand, and we will, of course, look out for that and we'll call you. As ENASO, we respect everybody's space and everybody's opinion. That's why we'd also request you to do the same. So respecting each other's inputs and feedback is something that we always want to champion for. And of course, network. That's why that's one of the key reasons we're here. And have fun while you're doing it. Webinars and dissemination discussions should not be all, serious faces. Just have fun as we go. Next slide, please. So we'll just kickstart and just get into the whole program itself. It's going to be in 2 parts. So we're going to have the preliminary bits where we're going to have opening remarks. We'll, of course, focus on what is the objective for this particular discussion. Then we'll bring in the consultant to actually present the findings of the report, and then we'll close it out by getting a reflection from your end. So that's where we'll expect more feedback from your end also. And then I have a co-moderator who will actually join in later on. We'll have a brief panel discussion just to get an overview of the findings that we've actually. Sorry. Great. I've seen one of the speakers. Rosemary, welcome. Sorry. I know you're on unmuted. Please mute yourself. Thank you very much. And then we'll get that panel discussion going. Welcome. Panel discussion going where Watara Gaya will be here to just moderate that. And of course, we'll get closing remarks from the ENASU team. Now, before I speak forever, because I love talking, let's get to the key findings. And this is where I hand it back over to Glory. If you're there, just please give us more gif about why we're having this discussion.
Okay, thank you so much, Liz. Good afternoon, good morning, colleagues, depending on where you're calling from. So thank you so much for joining this webinar. And just to take you through that, the objectives of this webinar, we just want to disseminate the learning needs assessment report, as Liz has alluded to. But again, we want to also hear to share the opportunities that will allow you to reflect on the learning needs together. We want to hear from you that does this result really reflect what is on the ground? Yes, but we can also discuss further on different approaches that we can use to respond to the needs identified. So feel free as we invite or we listen in from our consultant, Onesmus Mlewa. So before that, I think we would like to invite Niluka to provide welcome remarks from the Global Fund. Then we'll proceed with the webinar. So welcome, Niluka.
Thank you so much, Glory, and thank you, ENASU, for organizing this webinar as part of the Anglophone Africa Learning Hub activities. My name is Niluka, and I work as a Senior Programs Officer at the Community Rights and Gender Department under the Community Engagement Strategic Initiative. And I coordinate the learning hubs, which are supported by the Community Engagement Strategic Initiative. The learning needs assessment were conducted by all 6 of our regional learning hubs to identify community and civil society learning needs and gaps that are related to the Global Fund processes and other related processes, which needs to be addressed and strengthened in order to maximize community engagement in Global Fund and related processes, which in return would also contribute to maximize the outcomes of Global Fund grants. ENASU conducted this webinar, ENASU conducted this learning needs assessment early this year, and we took time to analyze the data that we gathered and come up with this report with key recommendations. The findings of this report really addresses and reflect on the learning needs and gaps among communities and civil society who are affected by HIV, TB, and/or malaria in the Anglophone Africa region, and really look at what are some of the learning needs and gaps along engaging in Global Fund and related processes. For instance, in terms of country dialogue, in terms of monitoring, implementation, monitoring, oversight of Global Fund grants, engaging in different other Global Fund processes, as well as programmatic and implementation issues, such as how do we integrate human rights and gender-related interventions into ongoing grants? How do we use community-led monitoring data to maximize grant outcomes, but also influence policies? So I'm really, really glad to be here today to listen to the key findings, which will be presented by Malewa, and also to engage in a conversation with you to reflect whether these key findings do really reflect the actual learning needs and gaps of our communities in the region. And as a whole, as a community, how do we then start responding to these learning needs and gaps so that our engagement could be effective, and as a result, we can improve and maximize the outcomes of Global Fund supported interventions at the country level. So welcome everyone, really glad to be here with you all, and I hope you will, as always, you would be engaging actively through the chat and through questions throughout the webinar. Thanks, and over to you, Lissy or Glory.
Great, thank you. Yeah, and my apologies. I don't know why I thought the objectives should come before the remarks. Apologies about that. But good. I think ideally for us, it's just also make sure that the findings we're trying to disseminate does actually depict the actual things on ground. And I like what you've just said, Niluka. I mean, how can we use data now to influence policies, influence the funding that is available, etc. So let's dive into the main agenda for today, why we're here. Onesimus, if you're there, over to you. Super excited and can't wait for your presentation.
Thank you, Lizzie. Always excited, eh?
Ever.
Okay, thank you very much. I know I have a very tight time, just under 20 minutes to do this. So I've really gone to the very juicy part of the report, which are the learning needs that communities identified. I'm sure participants and delegates here will have time to read the full report, which is quite lengthy. And we had conversations with Gloria, and I was like, how much time do we have? Because if we are to present everything, then it will take us longer. But we've tried to make it much more focused, mainly presenting on the learning needs, what communities actually really thought were the things they wanted to learn probably in the next 3 years, and probably a slide on how these results can actually be utilized. So I'll try to make sure that I stay within the time, so that we can be able to finish in time. So basically, this was the objective and the scope of this assignment, or the exercise that we did. And like Niluk and Glory just said, we were mainly supposed to be identifying community needs, ranging from the entire circle of global fund processes, grant fund request development, grant making and grant implementation, access to technical assistance, as well as to ensure that technical assistance skills transfer for sustainability. So we were actually looking at what are the distinct needs across the entire spectrum of global fund processes. What do communities think that they needed support on, or what information they needed? And that's actually took the center stage of this assessment. And of course, ideally, this was to determine future priorities for technical assistance providers. I mean, this report is very useful for technical assistance providers. They could quickly pick up the areas that actually communities are saying these are the areas we are actually looking for or have need for. And of course, we wanted to inform the Learning Hub to define its implementation of appropriate learning sessions for the Learning Hub. What are the areas that probably the Learning Hub should be focusing on to ensure that they provide relevant information to communities as we are actually progressing towards implementation of global fund grants in country. But of course, the scope was basically about documenting the community's learning needs in both Anglophone and some Lusophone African countries. And the overall goal, basically, to understand the learning priorities and capacity gaps for technical support needs of the communities in the region. So this was basically the scope of the work. And actually, before I actually continue with the key learning needs that we established, I must say that we did ask communities what areas or how have they been involved in global fund processes. And there was quite interesting findings here as well. Many of the communities acknowledged that they have participated, or they actually have been participating in the fund request processes. But as you are moving towards the ladder of fund request grant making to grant implementation, then a lot of the communities keep on dropping off. Fewer and fewer are getting engaged in grant making negotiations. Fewer and fewer are actually progressing to meaningfully engage during grant implementation. And these were some of the issues that were actually coming up in the report. which definitely you could quickly read. But let me just dive direct to the key learning needs that we found out when we did the in-depth and detailed analysis of our report, and there are about 10 or so core learning needs that communities presented as the things that they really would want to understand. And one, we are talking about communities and civil society needed to learn more about the entire circle of global fund processes. What exactly is included, or what processes do the Global Fund do that they actually need to engage in? And this was principally mainly to identify areas that they can actually be able to meaningfully engage through the continuum of Global Fund processes. Communities also and civil society needed to learn more about the Global Fund strategy and its priorities. Seemingly, yes, the new Global Fund strategy has been around now for a while, no longer very new, but still not very many communities and civil society really understands the full strategy and its priorities and how they can actually align to the Global Fund strategy. So this is something that communities also said they wanted to learn more, and it's a pointer probably to the Learning Hub and other partners to see how best to disseminate or to ensure that communities understand the Global Fund strategy and its priorities so that they can align their work as well. Communities equally wanted to learn more about the type of technical assistance provided by the Global Fund. And in the report, when you look at the technical assistance, it is much more on the modalities of how this technical assistance is provided and what is its scope of this technical assistance. Is it more leaning towards supporting provision of a particular service? Is it more of a grant where you are giving actually people some money to implement an activity? So this was the scope upon which communities really wanted to understand the type of technical assistance that the Global Fund provided and how best they could probably engage and access that kind of technical assistance. Moving forward, continuing with the learning needs, communities and civil societies also needed to learn more about how they can be meaningfully contributing to the planning, execution, and implementation, including monitoring of the country Global Fund grants. And this came very strongly, as I was saying, looking at the continuum of the areas that communities have been engaging. As you are moving towards grant making and grant implementation, then fewer and fewer communities and civil society were actually involved. So they really needed to know how do we become part, or how do we meaningfully contribute to the planning as well as execution of the country Global Fund grants. The reasoning here was that there was a lot of deliberate and intentional involvement of communities during the fund request. They will be sought, they will be found, they will be supported to participate in the fund request. But as the processes go towards now implementation, then you have fewer intentional efforts to ensure that communities become part of the implementation process of the Global Fund grants. Also, communities and civil society needed to learn more on how they can effectively engage and be part of the decision-making processes. That is at CCMs, TWGs, including interagency coordinating committees, budget committees, all this, and this related to how can communities become part and parcel of the decision-making processes. So a lot of the communities that responded to this study felt that either they were bundled together into large groups that not necessarily represented their interests, and this was a little bit more evident with the KP groups that. You have a huge, large number of KPs in a country that are represented by one sector that probably may not represent the entire sector of key population groups in the country. So this was an area that communities wanted to see how can we ensure that every segment in their diversity is meaningfully included in the decision-making processes. Moving further, communities and civil society also equally needed to learn more on how they can be global fund implementers. And this relates quite strongly to the point I had actually already explained above, that they really wanted to see how can we be part of the planning, implementation, and monitoring of the global fund grants. There was this was almost a very a strong push towards how do we become implementers. We are involved during the fund request, but when it comes into the implementation, then we are missing out. What is it that we are needed to do, or to ensure that we are also becoming part of the implementation teams? Communities also needed to learn more about how they can meaningfully engage and shape the fund request process during GC8. And this was basically more on lessons learned from GC7, because we did ask what processes have you been involved in, and in the process of inclusion or participating in GC7, then the technical support that was provided that time, they said was not continuous, it was not continuing, we fell off the way. So it's like they really wanted to know how they can meaningfully engage throughout the process in GC8 so that they can be part of the process of fund requests, grant making, moving onward, so that they are carried through. How can that probably happen? And this may actually tie up more on the kind and shaping of technical support that is provided by the different partners. How can they meaningfully continue be in the process throughout the GC8 process? Communities also needed to learn more about human rights and gender programming, especially in challenging operating environment where there is especially criminalization of KPs. How do they actually continue to operate? And the reasoning behind this was that during the fund request, there is kind of a deliberate relaxation of an intentional relaxation of the criminalization attributes by state powers. And then once the grant is actually secured, then you see increased tendencies of criminalization of key population groups. And the question, or what they wanted to learn more, is how do we ensure then we do not have these continuous spikes of criminalization of KPs in a space where the grant has been approved. It has KP indicators that are supposed to be achieved, but you look at its operationalization, it becomes difficult because the operating environment is increasingly or spikingly harsh to actually be able to implement some of the interventions. And then civil society and communities also wanted to learn how best to mitigate the impact of pandemics on HIV, TB, and malaria programs. And this was a kind of like a direct reflection of what happened during COVID-19, where communities felt they were less involved or engaged in determining what the mitigation strategies were. There were lockdowns, and movement to probably access essential medicines was difficult. So how do they then become part of the planning process should future pandemics come in, so that they do not suffer retrogressive consequences as they did during COVID-19. Further, I think this is the last slide on the learning needs. Communities also needed to learn more on where and how to access technical assistance to support them engage in national processes. And by national processes, these were actually processes that had a inclination or had related to global fund processes, including national disease strategic planning. If the country was doing their national disease strategic plan, for instance, and normally governments don't really provide a strong support to all communities, probably a few. How can they access technical assistance to be part of these processes and ensure that their priorities are aligned in the national strategic plans or national documents because when it comes into the fund request, most of the priorities that are aligned within national documents find themselves into the priorities of the country grant. And if communities are not going to effectively engaged in national processes, then they find themselves missing out. So it was all about how do we get technical assistance, where can we find technical assistance to ensure that we contribute or we are meaningfully engaged throughout the process of national disease strategic planning or national frameworks that have an implication on how the country grants are actually running. Communities also needed to learn more on how to identify. Yes, I'm finishing. This is my last slide so that then I can allow the team. Sorry.
Please carry on. I think somebody just joined in. I need to mute them.
Okay.
Just carry on.
Thank you very much. So communities and civil society also needed to learn more on how to identify, document, and prioritize their issues before key global fund-related processes. And this was, I think, the whole process of how do they turn their aspirations, their thoughts into actually really key priorities. And the reference in the document was more on what happened during GC7. Communities have a lot of thinking of what they actually wants to happen. But at the end of the day, when it gets into the actual writing of the grant, the writing of the grant has its languaging. There are drop-down menus that align on what actually indicators needs to be realized. So how do they ensure that the languaging of their priorities is actually in line with actually what is a profile within the grant? So they were talking much more on support to identify, document, and prioritize their issues. And then also communities and civil society needed to know how they can have functional community feedback mechanisms and keep them informed of decisions made as well as grant implementation processes. So this was about how do they keep tab of the entire process of global fund grants implementation, including decisions that are actually made at different levels. How do they get feedback? Sometimes that feedback requires resources. Even those who actually are in the CCMs may not have necessary resources to actually get back to their consequences to provide feedback. So these were the issues that actually were being brought out. So those were about 12 key areas of learning that communities actually said they needed to learn more in these next 3 years. And it comes out from the gaps that they have experienced over time. So in summary of the key areas for learning, it was much more, because we really did ask if you were to really prioritize, what would you really want to not miss in the next 3 years? And they really talked about preparation towards GC8 with the lessons learned from GC7. So if there can be a deliberate and intentional push to actually start planning for GC8 with the communities actually raising the issues that they experienced during GC7 and how they can actually better prepare for GC8, that would be very helpful. And then, of course, the human rights and gender programming perspective, and this comes on especially with the increased criminalization of key population groups in certain countries, and this was something that communities really wanted to see. How best can we ensure that we continuously thrive in an environment that is quite harsh and hostile? What are the best approaches for us to continue doing so? And also issues of pandemic prevention preparedness. And this was mainly informed by the drawbacks that came due to COVID-19 and the disruption of services. How do we make sure that communities are part of any pandemic preparedness interventions or decisions to ensure that they do not get back to a situation where they miss essential services? So how these findings could be used? I think these are very important findings that can actually inform planning and readiness for GC8. There are quite a lot of learnings if you read the report on what communities felt did not work so well during GC8. Like I have said, they thought probably some of the technical assistance support that was provided was too short-lived and wasn't able to make them go through the entire process. Also, I think these findings are quite useful for targeted capacity building for communities. As a learning hub, the greatest responsibility is to ensure that communities have the right capacities to engage. And I think these findings provide very relevant results that can actually be used to target strategic community building initiatives. Also, guided technical assistance requests. There are areas that communities have said we really want to understand more how we can access this type of kind of technical assistance or support that is needed. So these results can actually really be used to guide the type of technical assistance that is required by communities, but also improving communication and coordination. This will increase the feedback mechanism that communities will always be updated and know what actually is happening in space, and also improving South-to-South learning, especially when we are talking about human rights and criminalization in areas where communities are still able to access services and continue programming. How are they doing this so that other communities within the same facing the same challenges could probably adopt working strategies and be able also to ensure that they continue programming. So thank you very much. I think opportunities to foster engagement, regular virtual face-to-face and learning meetings, and I think this is the work of the regional hub. We should make sure that there is continuous either virtual or face-to-face learning sessions so that communities could probably get much more information on the things that they require. Civil society communities becoming global fund implementers. This is something that they requested. How they need to do this, probably this could be a point of what is it that other communities that have become implementers, what did they do? And this could actually be a South-to-South learning issue to see that this is what probably a particular community did to become an implementer, and others probably could adopt a best practice. And also having community at the implementation and decision-making levels. Thank you very much. Back to you, Glory. These were some of the very key highlights of the report, but the report presents much more information. It's quite a lengthy and detailed document, which I believe colleagues will be able to read. Thank you very much. And back to you, Glory.
Well, thank you, Onesmus. Still, I'm getting excited. Anything related to CSOs and money in the middle, it just gets my juices going. So thank you very much for that presentation. And I like the fact that, during the findings, GC8 came up. And looks like there's a lot of work to be done, because now if CSOs really do want to be GF implementers, we need to actually have those South-to-South learnings. Let's see what the other people did in order for them to be implementers, and what would be those key lessons and how to regroup. But also thank you very much for bringing in, like summarizing it. It is quite a lengthy report, but summarizing it into those beautiful slides and in less than actually 30 minutes. That was quite impressive. But what came out was the fact that communities need to identify, those needs that affect them directly, but also learn how to document, because when you document it, then you have backed up data that can support you into soliciting for funding, and also just, influencing policies within your individual country. But also, how do we know what to prioritize? And of course, we're going through a phase of Marburg. We're still dealing with Mpox. It's been there for quite some time, and now it's been given the limelight. So a lot of pandemics and epidemics are also taking, over the discussion phase. So TB, malaria, and HIV are being sidelined again. And this is in terms of, discussion, in terms of financing. So it's also good to see how pandemic preparedness is something that the communities can also, get involved in. And that is one of the key areas that INASO has been, really championing from the COVID-19 phase. So ladies and gentlemen, as I mentioned, this is the part where now we open it up for your thoughts. We'd want to know whether the findings that were made really do truly reflect what is on ground, and what are your thoughts around the presentation that has been made. And of course, I've seen the comments on the chats. We will definitely share the report, quite lengthy, but we'll definitely share it later on after this webinar, because it's being uploaded on the website, and you could actually download it and just dissect it at your own pace. Yes, Julius, the report is ready. It will be shared. I'm just going to kind of figure out if there's anybody who has any comment. You can use your electronic hand. Any thoughts whatsoever, we're welcoming it, because now we're going to the reflection bit. Yes, Davis, over to you. Thank you very much for using that electronic hand. Over to you, Davis. Oh, you're on mute. Sorry, Davis.
Can you hear me now?
There you are. Yes, great. Good to go.
Thank you. The presentation has been very good. It is well structured. But I want to say for the last 40 years that we have had this HIV, the issues of community relegation or being left behind has been on and on and on. And every time we have seen we put more efforts. This time again, we're looking at it and we are saying almost the same. I mean, what shall we do differently now so that at least the communities can be involved? Bearing in mind, these are the people who are infected, or rather affected. So they are the people who feel the pinch. So it's very important to bring them on board, and it is very, very important to ensure they start doing the work. The other thing that is a bit disturbing, and it is coming up again and again, is the issue of the word community. I think we need to sit down and agree who is the community. Because when we talk about community, it means different things to different people. The administrator, a DC or a DO, those people understand community differently. If you go to a health worker, he will understand community differently. Go to the civil society, they understand community differently. And even so more so about the PLHIV. So how shall we have the word community put in the right place? Because in this context, I want to believe it is the infected and affected. But if we went to the community, in the villages, community is everybody. So I think it is important we put this thing in the right context, so that when something for the PLHIV community is in the regions, it is known it is for them. But other people wake up and say we are the community. So when you come back, they say, no, we give the community. So I think it is important that we put that into consideration. Thank you very much.
Thank you very much, Davis. And ladies and gentlemen, we do not have an answer. So the reason why we've opened it for comments and reflection is because we believe that you do have the answers. So Davis, thank you very much for that. Yes. How can we get the communities involved? We've been talking about this for 40 years. We're still having the same discussions. I've seen Rosemary's hand, and who is the community? So if you know you have an answer to that, please just feel free to use the electronic hand. Rosemary, over to you.
Yeah, my name is Rosemary Kasiva from Nairobi, Kenya. I am a sex worker and I represent the key population at the country coordinating mechanism. Mine was just an addition to what Mulewa has just shared about communities ensuring that their priorities are aligned to the strategic framework. Another gap I saw in Kenya when we were handwriting was the issue of size estimate of especially for the population.
Unfortunately, Rosemary, your background is too loud. We're struggling to hear. Is it?
I think it's someone else.
It's someone. I have muted.
Oh,
sorry.
Okay.
Yeah.
Thank you. Sorry about that. Okay, no worries. Please carry on.
Yes, like I was saying about we talked about the strategic framework with priorities aligning to that. Also, there's another gap that we noted in Kenya when we were doing the writing and also during the grant making, like we didn't have updated data to support the activities or to support our asks. it's also key that we note that before we get into the writing process and the grant making process, we need to ensure that also the data that we're talking about, the communities that we target to reach, is updated data. I've also another challenge we also had was about I think the data is to support the existing gaps that probably we intend to meet. There is also the process during the grant making time. We noted that most of the priorities, or rather the activities that we had envisioned to work during the GC7 were dropped out, or rather during the recommendation that came from the Global Fund itself, they seemed to be missing. And it's not just a small number, a huge number that has really affected even the implementation. What measures can be put in place to ensure that all along, whatever priorities communities have written and is followed up to the grant making process, even all the way to the rolling out of the grant to be implemented. And commodities, I noted that there was no, can I say, transparency in as far as co-financing is concerned, because all along we had been told, oh, for the communities, this is what needs to go into place. But the government was non-committal to really say how much they're contributing in as far as especially procurement of commodities and the pricing and the costing. That was also not very, very clear. That is something that also needs to be looked at. And I know the recommendation that came after the grant making and during the SR selection, the KCM level, and this I'm trying to answer to someone who went before me who said, how do we ensure that more communities are able to implement? And I know this is a model that has been used by the MSM-led organizations in Kenya of implementation arrangement, where we have the SR-SSR implementation arrangement. It was a recommendation that was given by communities for this implementation that is ongoing. But again, we recommended this to the PRs and requested that we need to consider that, to ensure that most of us are brought on board, even if not as SR, but as SSRs. They came up with hurdles and said they don't have money enough for program management. They don't have money enough to ensure that this is implemented to the core, that in future that needs to be well budgeted, that needs to be well justified. I feel like we've been rotating in the same cycle, much as we have more communities able to implement the grant, doesn't seem to be working out. Thank you.
Great. And ladies and gentlemen, that's Rosemary. She's going to be part of the key panel discussion that we'll be having in the next couple of minutes. But Rosemary, thank you very much. And I totally agree. I mean, first of all, of course, data is crucial. That is something that also Niluka mentioned. And we need to have data to back up our requests. But also, yeah, it becomes such a nightmare trying to trace the exact amount of money that has been set aside for different, initiatives by the government. That is still a key gap and an ask. But I've seen also two more hands that we can take before we get into the next session. Gesonko, over to you. But ladies and gentlemen, feel free, if you have any sort of response to the queries and comments that are being made, feel free to use the chat option, but also feel free to use the electronic hand, as this is supposed to be like engaging. It's good to hear from the communities directly. Over to you. Well, I've lost. Oh, there you are. Okay, over to you. Yes, over to you.
Thank you very much, Lizzie, for this opportunity to respond, and thank you very much to Muleo and the rest who have just responded. Mine is just a gritty concern, and as to why communities will continue struggling to access or to be meaningfully engaged in Global Fund, because I speak from the vivid example that and actually, majority of you might have heard the statement which was said by Mwalimu Julius Nyerere that when you take a featherweight and a heavyweight, you put them on the stage for boxing, you'll be creating murder. If communities are not empowered to meaningfully understand what is their role, what are they are serving at which capacity, they will never compete favorably in the environment at which the government is operating. And most of the CCM are a pro-government. You have to speak, we call the spade a spade.
Thank you very much. Totally hear you. Now I'm going to throw Glory right under the bus because that really touches on what you're doing. And of course, ENASO is here to help with any TA assistance. I guess that's one of the key discussions, Glory, that during the closing remark, you might want to also touch on how they can actually reach out to ENASO to just get these TAs for malaria, for TB, for HIV, so that they know where to go to. I mean, that is why we have ENASO running the Anglophone Learning Hub for all these questions, because they do have the answers, and there are TAs for malaria that Glory will also touch on as we close. I know we have 7 minutes. I'll ask Omar and Similane, if you can just choose like a minute or two for your question so that we can dive into the next panel so that we get more time for Q&A, because we still have a panel discussion going on. So Similane, over to you, then Omar.
Thank you, Lizzie, for the opportunity. I'm Oliswa from Eswatini. So yeah,
Welcome.
my first, it's not a question as such, but I think as public health people, we still lack motivation. Like most of the time we want money. We want funders to give us money. We are not motivated to produce data. We have data in our dispository that could inform policy, but we want to be funded to do research. I personally believe that with the data I have with me, there's a lot that I can do with the data. For me to get funding, I need to use that data. So you don't need, like, can write policy briefs, you can have quality improvement. Start very small. Don't rush for big things. Start, yeah, I think that will make sense. That does make sense.
For sure.
So I feel like as communities, we are lacking that. We then take the blame, we shift the blame to our funders to say, give us more money, give us more money. Let's give the funder the reason for her to fund us, to give us money. Let us motivate the funder to do that. So
Exactly.
secondly, what I've noted is that, not in a bad way, please hear me very well here. I've seen most people affected, which are people living with HIV and everyone, key population. Sometimes we want to own the organizations while we don't have enough capacity. You find that sometimes I'm speaking from my experience, you find that sometimes we dodge the system. Remember, here we are not dodging the system, we are dodging the people we are serving. I think we need to have the people we are serving in mind before we can shift the blame. So if I'm going to report that I have I've 100 new infections, whereas I have like 50 because I want more funding, that is not justifiable. That is not fair. So I think we should have that humanity within us as public health aspects. That's another thing. So as people are climbing the ladder, we have seen a lot of community organizations failing. Why? Because they don't have the capacity, because they are using the resources wrongly. Then that is when now we can say, as Global Fund, please provide capacity for those organizations, for those new organizations, for those baby organizations. Yeah, that is what
For sure.
I wanted to share. Thank you.
Thank you. Thank you very much. Appreciate it. And I know during the opening remarks by Niluka from the Global Fund, he did actually highlight that we need data, and that data will help us influence policies, funding requests, etc. So it is crucial. And I like the aspect that you brought in, that, you know, start small. It's not about just asking for money, but there's some impact also, but we need also the evidence to prove that we need that particular money from the funders. Yes, Paul, I've seen you. I think we dropped Omar. So Paul, over to you. Paul Brima, you're on mute. Or is that an old hand? Okay, Paul is having a bit of a difficult time with his trying to unmute himself. But Paul, when you do, let us know. But okay, great. So ladies and gentlemen, we're talking about the findings of the needs assessment that we did as the NSO, and of course that has been compressed beautifully, I might add, by Onesimus, and of course the full report will be shared. But before we do that, this is an open discussion. We're trying to figure out, is the report reflecting the true things on ground? Are those the needs? Are those the gaps and the recommended way forward? And how can communities be at the key in the middle of all this discussion, but also to kind of give you a little bit of hope. We've seen the role of communities kind of, you know, the space becoming a little bit tinier as we speak, but then we have organizations that are also pushing for the voices of communities and civil society organizations in spaces like, you know, the INB discussions are ongoing about the pandemic treaty or the pandemic accord for next year, which we need to have one by May next year. And of course, at the beginning, communities' voices was not there, but we have organizations like ENASO, the Pandemic Action Network, that have been pushing to have our voices in such kind of spaces. So as much as we, you know, we see our voices kind of shrinking in that space, there are a lot of other efforts and a lot of other organizations that you can also join to help push that agenda and just have communities, because we know the problems we're facing, and we do, believe it or not, we have the solutions to these problems. So I'm just going to check if my co-moderator is there. I don't know whether Watara, you're still on the call, or did I lose you? Sorry, I need to hand over this session to you. Glory, if you can just confirm. Perfect, there you are. There you are. Well, ladies and gentlemen, the second part of this discussion is going to be handed over to Watara Yaya, a very young and passionate Ghanaian. When I met Watara, I wasn't so sure whether I was going to like him, but if you bump into him and you see how he talks about the youth and their voices within the health space in the continent, you'll automatically, understand why he's doing this. So Watara, over to you. I'm handing over this particular session.
Thank you, Lizzie, for is a compliment? Yeah.
A lot of compliments.
I appreciate it. Thank you for the beautiful moderation and Naso and others for the beautiful and insightful discussion. My work here is very simple because I think Lizzie has done all the work. We call this aspect that I always like, let's invite the experts to give us a more detailed insight from their experience on the findings. What does that mean to them by their experience? What can we use the funding for? These gaps that have been identified, what is the way forward? Then I think we have a very beautiful and more experienced people here that cut across almost all the areas that we are looking at in terms of community voices, our technical agencies, and then also we're looking at the Almighty Global Fund. So I think this is going to be more interesting and it's going to give us more insight as to what are the strategies that we can use from these findings and addressing these gaps, and also exploring ways that we can integrate their insights into ongoing and future projects. So in no particular order, I think these are people that they are known faces and they are known names in the space. If I want to go into their bio, will not end here. So I will just say something brief about them. We have Felicita, who brings about over 10 years of experts in guiding civil society organizations across Africa. And I think she's doing well and also representing the Africans on Africa on the NGO delegation to the UNAC coordinating board, and also contributed as a journalist or presenter in most of the AIDS conferences across Africa. And I think it's great to have this experience. And the next person on my list is Rosemary. Rosemary also represents the sex workers on the CCM in Kenya, and also an oversight member. So I think this is great opportunity to hear from the community. And from our technical agency, we have Dominic from the UNS, a consultant on community-led response and also community mobilization experts, and has some social justice and inclusion. He's from the social justice and inclusion department on UNS. And last on my list is our own Glory from Yanaso. Glory, in fact, she's managed the regional grants across Anglophone Africa, and she's also has a lot of experience in terms of managing donor grants from organizations such as the Global Fund, Amplify Change, and more particularly, Glory is so much interested in young people, especially age-wide double adults and girls and young people. So I think we have all that we need across board, and let's just kick into action. Okay, I'm just going to speak to Felicita directly. If you can hear me, I want to find out from you, what do you think about this report? What are your reflections on this gap that has been identified? I did a true reflection on the grounds. I did the community needs currently. And what do you think should be your top 3 priorities as per the report that has been shared? So yeah.
Hi, Watara. That I think is for Rosemary. Can you check the question for Felicita? Sorry.
Yes. So if Rosemary can take that, okay.
Yes.
Can carry on with that. Yes, please. Yeah. You have 5 minutes. I don't have much time, so please, if you can do that within 5 minutes, that would be great. And if you want me, you can over.
Yeah, I'm here. I'm back again. This is Rosemary. If I think the report reflects the community needs and gaps on the ground, yes, with the additionals of what I had shared earlier.
What can you suggest?
Can you hear me?
Yes, loud and clear.
Yes. So like I said, yes, I think the report reflects community needs although not all the community needs. I believe earlier when I spoke, I may have highlighted a few issues that I feel also should have been captured. And one of it is when we talk about ensuring that our priorities are aligned with the strategic frameworks of a country, we should also consider the issue of data, because data was the biggest and hugest challenge when we were doing our writing and grant making in Kenya. So it is good to have updated data, especially for the key population. I had noticed that we were working on a data that had been collected 7 to 8 years back, and by then data had changed, and the landscape of what we were supposed to address had totally shifted and changed. So as communities from our end also, as we prepare probably for the next writing, we need to have updated data, and we also need to have considered the needs assessment, be able to document what exactly is happening on the ground. Another thing that I feel needs to change, I think the earlier speaker spoke about malaria, and they need their capacity to be built. For me, I feel capacity is a continuous process. It's not a one-off process. And I think the biggest challenge we have is the goodwill to ensure that communities implement this grant. I believe the stakeholders in different places and spaces really don't have a goodwill of ensuring that communities also are able to implement the grants that are meant for them. And they have ensured that we have barriers in every way. We have barriers on the grant that has been maybe the monies that have been allocated to the country. We have barriers in as far as our data is concerned. We have barriers in as far as our gaps are concerned. We have 1,001 barriers just to ensure that the lock us out of all this. And also another challenge that I'm seeing in the country that also needs to be worked on is the issue of SR selection. I think we've kept the SR selection issue at the KCM level for too long, and it needs to change, whereby it reflects the needs of the communities, and it reflects the essence and the importance of having community-led organizations implementing their grant. Because if we continue the same status quo, very little is going to change. I think that should also have been documented. And I talked earlier about implementation arrangements, whereby we feel, yes, we may not want to really do an overhaul of the SRs that are implementing different grants, but is there an implementation arrangement that can be made to work, whereby community activities are implemented by community-led organizations, and the other activities that probably that communities don't have capacities of implementing are allowed to do that, so that we can have a very good implementation arrangement, whereby, say, facility A does this, and the community-led organizations around that areas are supported to complement the work that's being done by those different facilities in as far as implementing the grant is concerned. I think I'm just answering everything, so whatever falls into place will be put where it needs to be put. We also need to really be keen on giving reasons why we need to be funded. We just cannot say that we want to be funded. What are the reasons? What are the existing gaps? And what is there that we're going to do differently to ensure that the services that are meant for us for HIV, TB, and malaria reach to us, and what changes are we therefore going to bring into place? I think that really needs to be very clear, and justification of why we think community-led organizations in different spaces and different countries need to be supported to implement the grant. Something else that really also was a challenge in the country is that, as usual, there is always a push and pull between communities, especially during grant making. We have division among communities ourselves. Instead of pushing for community activities to be implemented by communities, there is always some division that has been brought about by the state, whereby we have a few individuals or a few of us representing us in few spaces being given information that is not real, that's not factual, that all CSOs want this, community-led organizations want this at the expense maybe of, say, ARV drugs and all that. So a lot of division. We need to have facts that guide how we are approaching the grant writing and the grant making to ensure that we are able to make changes. And overall, even for the PR I think the problem starts from the PR selection to the SR selection. We really need to relook at the strategies that are in place and the structures in place of those those selections, and ensure that in the next 3 years we are able to embrace what changes we want and how the changes should look like, so that come the time of PR selection and SR selections, our issues will be factored in as communities. Thank you.
Thank you, Rosemary. That was great. And sorry, Felicita. I kind of interchanged because I didn't have the right information. Felicita is actually from Global Fund CRJ Investments, and then I would want Felicita to tell us from the Global Fund angle. What do you think, Felicita, from the Global Fund angle? We believe that addressing these key learning gaps is very crucial to maximizing.
Hi, Watara, I can't hear you.
Yeah, sorry. Watara, I think you're muted. If you can unmute yourself. Sorry about that, Felicita. He was
Right.
actually in it. Yeah, Watara, if you can hear us, you can just unmute yourself. Well, in the meantime, I'll just kind of run with it. So we believe that addressing this key learning needs and gaps that have been represented and actually shared by Ian Onesmus is critical to ensuring maximum outcomes from the Global Fund investments for sure. But we would like to know, Felicita, what opportunities do we have within national grants to address this particular needs and gaps that we kind of were shown, and what should communities aim to advocate for? Who are our allies? It's good to know who your friends are so that, you keep them a little bit closer. So over to you, Felicita.
Thanks, Glory, and thanks to Watara for starting the question. I just want to kind of step back into where I was about 2.5, 3 years ago as the director of a regional NGO in Southern and East Africa, called the AIDS and Rights Alliance for Southern Africa, and just share that I found the assessment and the findings of the assessment really refreshing, and I think exactly where I was 3 years ago. If I were asked the same questions, I would have probably come up with the same capacity needs in terms of what we need to address in terms of Global Fund processes and platforms, etc., and engagement of communities at that space. So this is quite comforting in the sense, it's quite alarming, but also comforting in the sense that compared to where I'm sitting now, the needs remain. And with that, I want to also just say something about the fact that we shouldn't get tired of doing the work that we're doing and championing community voices and community engagement. We've come a far way. When you think back to 20 years ago, when I started working in this space, we were really at the cusp of the space opening for community engagement at governance level within the UN, within the Global Fund. Global Fund was just getting set up. And it was something that we hadn't seen before. And we got stronger and stronger in terms of community engagement, representation of communities, and also representation of the most marginalized communities within the HIV response. So we shouldn't be too depressed about where we find ourselves, because we have come a far way. But then we should also remember that there's some work that we're going to have to do forever and ever and ever, as long as our communities remain marginalized, as long as our communities remain at risk of HIV, TB, and malaria. We're going to have to keep pushing for communities to be centered, to be at the forefront of these conversations, forefront of planning, decision-making, implementation, monitoring, and to have a seat at the table. So we shouldn't get discouraged or disappointed by the fact that we still have to do this work. And I'm saying that also for myself, having recently, a year ago, stepped into the Global Fund space, and realizing how much work there still is internally to advocate for community voices. And so, at the beginning, I got a little bit jaded, but then I realized, you know what, this is our life's work. This is our purpose, and it's not going to go away as long as our communities are marginalized. We're going to have to continue to champion community voices, continue having to push for it. So let's not get discouraged by the fact that we still have to say the same things we've been saying for 5 years, for 10 years, for 15 years, 20 years. Just remember, as a parent, you're going to have to continue to parent your child for the rest of their lives. This is work that we're going to have to do for the rest of for as long as the needs of our communities, remain. So do take heart, but also, to take a moment back and reflect on how far we've come, and not to kind of downplay the needs that have been identified in the needs assessment. I also want to just say, we also need to give credit where credit is due, and recognize not only how far we've come, but the fact that the Global Fund is actually one of the few donors that makes space for communities right from governance level down to implementation. What that looks like is not ideal. So in some places, it's not, there's lots of work to be done. But within the partnership, communities have quite a lot of influence. And civil society organizations, NGOs, implementers, communities have a role to play. When you compare to some of the other donors that I used to have to beg for money, who didn't really care much about, community voices and some of the community rights and gender issues we are passionate about. So just wanted to say that as a disclaimer, and just as a little caveat to what I'm going to say next in terms of the opportunities that exist. And the question you posed was really specific to the country grants. And there's a lot more opportunities that exist outside of the country grants, such as through these strategic initiatives, what they call the catalytic funding, which is part of what supports the community engagement, or what the community engagement strategic initiative is a catalytic fund to support community engagement. And so those opportunities exist outside of the country grants. But within the country grants, quite a lot of countries invest substantially in community system strengthening. And when I started to get more involved with the Global Fund, what I realized is that oftentimes as communities, when we look at the Global Fund modular framework, or the funding request, we tend to focus on the disease areas that we work on, and not so much on that module that's called the resilient and sustainable systems for health, which is where our community system strengthening modules and interventions sit. And so a lot of what I've tried to do is also to point partners to the CSS and RSSH module to say, when you're in those funding request writing teams, somebody needs to go to the RSSH writing group. We can't all sit in HIV, we can't all sit in TB and malaria. Somebody has to be in the RSSH working groups, so that we can make sure that our organizational development needs are covered. And so there is an intervention area called it's called community institutional capacity strengthening and leadership, I think it's called. So quite a few countries have invested, or within the region that I support, all countries have investments within the CSS module, and specifically under that or institutional capacity strengthening and leadership line. Sometimes that line includes small grants, it includes trainings on organizational development, et cetera, but often in some countries, like in South Africa, for example, it's used not only for the Global Fund implementers, it's actually used to strengthen community systems broadly. So, there's like, sorry. In GC6, for example, they trained 400 community-based organizations and gave small grants to 200 of them that had nothing to do with the implementation specifically of the Global Fund intervention. So there are countries where an effort is being made, and that's the kind of places where within the grant itself, where you would look for what has been budgeted for, and then engage around which groups are eligible for this kind of training and support, but also within your disease-specific modules. There's funding for strengthening of community implementers and partners that work on specific thematic issues. So like human rights and gender, there are trainings included in there around some of the issues that you mentioned, in terms of capacity needs on a technical side. In the C19RM budget at the moment, there is quite a bit of investment in integration of PPR into community system strengthening and resilient and sustainable systems for health. So those budget lines often have a training component, for civil society and community stakeholders to understand what integration of what PPR is about, what it involves, and also what integration of PPR is within, for example, community-led monitoring, and how you would monitor and include a component on pandemic preparedness and responses. So there are quite a few opportunities, and you know, as I said, the strategic initiatives are some of them. The allies, development partners, UNAIDS is here. They're a great partner. They're investing quite a lot in technical support through their technical support mechanism as well, for communities to engage in global fund processes, but also particularly in implementation. So, you know, providing technical support around gender assessments, human rights plans, you know, quite a bit of work that can be fronted and led by communities, and strengthen community understanding of kind of the technical programming side of some of these responses. The development partners, some donors, there's a lot of donors that really are centering community engagement. A lot of philanthropy types of foundations, institutions that make it their core work to not only protect civic space and civil society space, to operate, be a watchdog, and do advocacy and monitoring types of work, but they also invest in community leadership, you know. So those are our allies. There are also regional and international organizations whose core business it is to strengthen capacity of civil society and communities around the technical sides of engaging with the Global Fund, but also in terms of program implementation and understanding, for example, what evidence-based human rights programming is. So look out for partners like that. Also within, I mean, I think we do tend to, as communities in civil society, I used to be in that space, we do tend to, you know, be very critical of government, but we do have allies within government institutions. In the year or so that I've been working with the Global Fund, I've engaged quite a bit with the community health units, who often host the community system strengthening and community systems technical working groups, or that supports them. So those allies do exist within government institutions as well. Yeah, let me stop there.
Yeah.
I think I've said quite a lot. Sorry about that.
Yes. Thank you so much, and thank you, Lizzie, for coming through. I think when I was listening to Felicita, I can't summarize everything, but the one key thing that stood out for me is, as community, is for us to keep talking, regardless of how many years we have to keep saying the same thing over and over again. And as a young leader in Ghana, I think one thing that has worked for us as young people in this space is to keep knocking, regardless of the number of times they say no, the number of times we have to keep saying the same thing, that this is what we want and this is the kind of change we want to see, and we have to keep talking. And for the first time, this has paid off. I can say this is the first time in Ghana that there is a young person on the Ghana CCM. So I think saying the same thing over and over again, even though it's not supposed to be so, but it's this sure way to make sure that our voices and issues are put across on the table where decisions are taken. And I want to move directly to UNAIDS. Dominic, if you are there, as a partner, just like the Global Fund, we know you also have a whole lot of support in this area. So you should, can you tell us what support do you think your organization can assist us in addressing some of these needs that have been identified? And is there any best practices across the region, especially that we can replicate it in the Anglophone regions? So thank you, and over.
Thank you, Wadar. Yeah, no. Thank you for this session. It's great to be part of this conversation. So in short, can UNAIDS support? Yes. As Felicita mentioned, we run the technical support mechanism, which she mentioned a couple of examples of the work that the TSM supports. My name is, so I come out of the Gender Youth Equity team, and my focus is primarily on community-led monitoring, and so that's where I'm most familiar with the programs that are supported. But I think the things that I'm going to talk about today are broadly relevant to any of the work that you might be doing with you know, in terms of planning for the GC8 or through implementation. So in short, the technical support mechanism is a facility that is funded by USAID, housed at UNAIDS, and it really is there to catalyze the investments made through the Global Fund. And I think that's a really important thing to remember in in terms of it is a technical support mechanism that is primarily intended to support and optimize Global Fund programming. So in terms of learnings, there are a few things I want to point to that came out of the excellent presentation earlier. Great to see those conclusions. I won't reiterate everything right now just because of time, but it's great to see those broad themes come out. I think they have been broadly relevant for some time, and I think they will continue to be. These are not things that change, and that kind of leads me into the first element in terms of a learning around what I've seen is that capacity building support and technical assistance, it's a process of continuous support, continuous improvement. And one of the things that I think we really need, UNAIDS has been talking about a lot recently, and I think has been a theme, particularly in the CLM space, but I think relevant to all community work, and that is resilience and sustainability. Sometimes we're so focused on implementation today, we're not thinking about resilience and sustainability. And why I mention that is that within organizations, people move around. If one person or a very small group of people have been capacity built, and you find because of career development they move on to other things, that can really impede your ability to deliver over time. So I think we also, as communities who are implementing, who are receiving technical assistance, I think one of the things that we really need to think about is how capacity building is both delivered in the specific kind of formal TA assignments, but actually beyond that, how we're doing more peer-to-peer training, how we're bringing in partners who may not have funding but are doing relevant work and are close collaborators, so that we are building a more resilient, sustainable response, that there is some interchangeability there. Now, I don't have lots of great examples of this. In fact, I've got lots of great examples of a lack of resilience, where there's like one person who's a data analyst, and if that person moves on to another space, that program is going to have lots and lots of problems. I've seen even in some very large CLM programs, ones that we call gold standard, and I'll keep them, I'll keep them anonymous just to protect the innocent. But we've got external people inside the organization who are basically keeping those programs afloat because there isn't the capacity in the organization. So I think we need to be thinking about capacity within the organization. We need to be thinking about resilience. We need to be thinking about sustainability. And I think you should be doing that through all of your funding, but also your TA requirements, and having honest conversations with everybody. And hopefully next time round, when we are having these conversations, we'll be able to point to more examples of resilient and sustainable responses. The second thing is, I think we really, and it builds on that last point, it's about building communities of practice. Now, communities of practice, they cover all manners of sins. It's a terminology that's used over and over again. Now, we facilitate some communities of practice, but they're not communities of practice in the sense that, I like the global one that I facilitate for CLM. It's informed by what people are telling me they say they needed, but it's not really driven by communities. I really am interested in seeing more communities driven by the implementers themselves, who are having conversations generated by their local needs, etc. And a good example of this is in the Asia Pacific region, where CLM didn't have the initial kind of push of money that many parts of East and Southern Africa had. And so there were some regional grants that like CDC gave. And what we saw there is a much more kind of regional approach, and something called the 7 Alliance was created, which is basically 7 regional networks have come together to lead CLM work in the region. Capacity building work has been undertaken to support the 7 Alliance to be able to support countries in the region moving forward. So building resilience, building sustainability, like keeping that knowledge in the region, but recognizing that sometimes the grants and the organizations on the ground are quite small, and so therefore the regional networks are the backstop, are the ones to provide capacity building support and other support. That community practice has now been going for a couple of years, and I think has been a really successful example of actually a more regional approach. we're trying to help foster a similar response in the Caribbean, where you have, compared to some African programs, micro level programs, in Trinidad and Belize, really small kind of CLM responses. And when I bring examples from Africa, for example, they say, how is that relevant to us? Because you're talking about totally different systems, totally different scales. We're trying to improve the learning within the region because that's where they see the commonality of experience. And so one of the things I would be looking at, those people in your region that are leading, I would be looking to them to say, can you bring us together to have regular conversations? Together we can form agendas, together we can address issues, and where needed, maybe sometimes we can bring in external speakers, or sometimes it's even TA to support the community, not a single organization, thereby building sustainability and resilience. The third thing I would like to say, and again builds on the last two, is I think we also have to recognize what's relevant. Sometimes when something is offered, we kind of want to, I have to review a lot of the TA requests, and sometimes we see everything thrown in there, and I'm like, but didn't you do this exercise or a version of this exercise 18 months ago? Oh yeah, but we want to refresh it. But resources are limited, right? Even for TSM, it's a significant resource, but we have to be mindful. And also, I think we have to also say, if you've had that capacity building support and you go out and you try it, if it isn't perfect, that's fine. Learn from it, document how you've learned from it, move forward. You don't always need the crutch for a TA. So I think one of the things that says that to recognize your own capacities and what's most relevant to you. And I think, sometimes, we've seen this year a number of country visits, like people going to visit other countries. And it's a real challenge sometimes trying to find the right countries to visit, because everybody wants to go see, for example, Richitse in South Africa, but not everybody has $3 million in CLM money. And how relevant is it if you've only got 50,000 in your country? And then the last thing I'd like to say is you've developed a methodology called the progression matrix. And the progression matrix is really a tool to help support planning, and by going through a reflective process to consider against the CLM guidance, which we published 3 or 4 years ago, against that guidance, how are we doing? And looking at kind of 5 key variables, around community leadership, about partnership, around action accountability, so advocacy, and also resilience and sustainability. And so the idea here is really to help give a framework for people to consider how far have we got, and if we are falling short of what we would like to be, how do we set objectives for the next year, future? And then how can capacity building, how can partnerships, how can mentoring help us address that gap? So I think whilst that is CLM specific, it probably does have relevance to some areas, but the methodology, the process of thinking on an annual basis about how far you've come before you start setting your objectives for the next year, I think is a really important consideration. That methodology has been used really well in a number of countries, and I point to Malawi and Cambodia, Myanmar as a few countries where they've done great work using that methodology to reflect on progress and plan for the future. So those would be 4 thoughts, I think, from TSM and from our work that I think might be relevant to this group.
Yeah.
And I'm very happy to, given time, to follow up if people want to reach out to me if they want to learn more about any of those things.
All right. Thank you, Dominic. That was very insightful. We are running behind time, but 30 seconds. What I really feel, in fact, I'm not so different from Lizzie, because when we hear about catalytic fund, TSM, TA, we become very excited, because it gives community an opportunity to actually do some of this work. But one thing around TSM that I want to put across quickly, so maybe for further reflection and engagement with other team, is sometimes the process through the UN is the TSM. It's quite very lengthy for community-led organizations to access it, and sometimes the program priorities, the outlook, it becomes very difficult, even as a youth-led organization trying to assess TSM for youth engagement. Sometimes it's very difficult. Is there a way, are we thinking around how we can make it more flexible for community-led organizations to be able to assess it without these lengthy processes? It's something that Dominic, I just wanted to reflect around it and see going forward, how can we make those processes more accessible for community, flexible enough?
Yeah, so I think so it's a great question, and so part of that process, part of that inflexibility is partly because when a request is made through TSM, it is a like a competitive process. So it's not like there is three options come back, and there has to be an assessment and a justification why the person being chosen is moving forward. And before that, so there's a significant time commitment on the part of the UNAIDS country team has to facilitate this process through the technical support mechanism. I would say the best way to minimize your time overall is to spend a little bit more time in the beginning. And what I mean by that is every year the country team has to put together what they call a technical support plan. So this is all the expected technical requests that they're going to have to submit to TSM for the coming year. Now, in reality, obviously, they often add things later because things only emerge later. But start the conversation early. Don't start the conversation 2 or 3 weeks before you need the funding, before you need the TA. Try and start that conversation with, if you're going in by yourself, with the UNAIDS team, at an early stage about the technical assistance requirements. I think given capacity issues, it would be really smart if we could find ways to consolidate requests, like where multiple organizations have similar things, and try and consolidate the TA support. So multiple organizations in a room who are working towards a similar objective. But start the conversation early with the UNAIDS team, so that it's on their radar that it's needed, and you can also help them by clearly on paper writing out what it is you want, because the hardest bit of the form for them is to actually explain what the TA request is, what it is building on, what the objectives are going to be, and why it's important. It's for you guys. So if you could do that, then that will help the process.
Exactly. Thank you so much. I think this will be a great discussion that Inaso can note for some other time that we can go into details. We don't have time. Thank you so much, Dominic. That was very insightful. Glory, if you are around, please, can you take it up for the run-up? Just give us your reflection on this. We want to know from your plans, like, is there any other plans that you have currently that we can use to identify, to address some of these gaps that has been identified? We have to GC7. What are some of these plans that are ongoing or in the pipeline to address some of these critical gaps that have been identified? Glory, over to you.
Yeah, thank you so much, Watara. And really, the report spoke it all. And as the Learning Hub, when we went through the report, seeing what communities and civil society needs, so we regrouped like the needs that were identified into 6 areas to start with. And we started on one of thematic area on global fund designing, like communities mentioned that they need more information or to be capacitated on how they can engage in the global fund designing, meaning from the funding request processes. So as Learning Hub, we are planning to ensure that communities receive relevant information, guidance, and capacity building for each stage of the Global Fund grant cycle. So I know that next year, towards the end of next year, Global Fund will share documents, guidance to prepare for the GC8. So as the Learning Hub will be available, will be there for you, making sure that we know one of the area we have realized that communities say that Global Fund, and not only communities, true, that Global Fund documents are more complex. Even us that we have been working the Global Fund for some time, we still don't understand some of the documents. So we understand and hear you. So our role as a Learning Hub will make sure that we share information, we digest, or we make the information as simple as possible so that communities can understand and be able to meaningfully engage. Another thing on the grant implementation, we have seen that one of the areas that communities start, they are much actively during the fund requests that we have seen. But when it comes to grant implementation, they are left behind. So as a learning hub, we want to ensure that communities have comprehensive information to enhance the engagement during the grant implementation stage, making sure that we see that even the TA, during the TA request, we receive a lot of TA requests during the funding request, but during implementation, we don't see that. So we are planning to even to share some of the great lessons or great TA that other regions or within our region, communities have requested to implement or to support them during the grant implementation. So that is another area that we are thinking we can address needs identified. On the TA, Global Fund do provide short-term and long-term TA. We also have other TA providers, and UNAIDS is here. We have GIZ, Backup Healthy, we have Initiative. So our role is to making sure that we map out all the TA providers. We know resources are never enough, but we'll try our best in making sure that we link you with proper TA providers as per your needs. So this is our role, and for the short-term TA from the Global Fund, we are actually the ones supporting you to review. So we will share the link with the TA guidance note, which explain in details thematic areas that the Global Fund support. But again, we take you through. We know sometimes communities say we don't know how to fill in the form, but as a learning hub, that is our role, making sure that we help you in filling out the form. We guide you until we are all comfortable that this TA, when you get this TA, really will the impact or out of the TA, you will receive what you needed. Another area is on the capacity building. I've seen the areas where communities needs to be capacitated. Even Rosemary, when we were discussing, even Gesonko, when he mentioned that capacity building. But as Rosemary mentioned, capacity building is an ongoing process. It is not a one-time thing. So we believe that for the coming 2 years as a learning hub, we will prepare a well-tailored learning sessions as per the needs identified, as per the topical issues. I know that an area of Global Fund strategy, we developed the community guides on the strategy. We'll find the better way we can go through the strategy in details again. Issues on safety and security, community system strengthening, and other topics that you as communities have identified. So we'll reach out to other expertise who will help us to facilitate and prepare very tailored learning sessions, which I believe can be of helpful as we try to address the needs identified. There was another area on communication and coordination. Yes, we as a learning hub, we try our best in making sure that our communication are simple, easy, and even when you read it, you get motivated to read it. So we really appreciate for that feedback as well. And we promise that for the coming 2 years, we will try our best in making sure that YANASO as a learning hub is your reliable information or repository center. So some of the mode of delivery that we are planning to do, we can do both virtual learnings, and we can do even a tailored, not to have both HIV, TB, malaria, KP, AGY. We can have a very tailored, specific learning session so that we utilize the time, we accommodate questions, and we all go together. Another, we think of having physical meetings. I know it's expensive, but we also understand that also physical meetings have different impacts compared to virtual learning. So we'll try whenever we get funding for that to do that. Case studies, community guides, and so many other areas that or mode of delivery that we think we can work to you, and we are still open for ideas on how we can do better towards achieving our goals. So that's all from my end. Watara, over to you, Liz and Watara. Thank you so much.
Thank you so much, Glory. That was very insightful. We are far. I like the fact that there's going to be more capacity for communities, and there's going to be more engagement, and you have already made plans for such engagement, because practical reports like this, it ended up on the shelves. And for us as community to hear the commitment being put, that this is not one of the reports going to be put on the shelf right after all the work that has been going to be an advocacy piece for us, and it's going to be an opportunity to engage, learn, and cross-learn. I think it's reflection. So let's see what and how best we can all contribute to ensure that this is successful. Lizzie, over and
Great. Thank you, Watara. I mean, it's always a pleasure just working, hand in hand with you to moderate. Ladies and gentlemen, we're coming to the close of this discussion. I don't have much to say, because if you were paying attention to the presentation from the beginning, then you'll see even the concerns that are being raised by yourselves as communities, as civil societies, have been captured on that particular report. And thank you very much, Onesmus, for just taking us through the needs assessment report. Of course, we're closing, all protocols observed. We need to take it back to IANASO, and I'm calling upon our acting ED. I saw Roderick on the call. I don't know whether he dropped. Roderick, there you are. He's going to give up the closing remarks, and it was a pleasure just hosting this particular discussion. And as Glory said, IANASO is more than happy to assist with any sort of queries that you have. And I would also request Glory just to have a couple of emails on the chat so that people can also have a direct way of reaching out. And of course, we'll also share the link to the report, which Glory has just done. I'm assuming, Glory, that's the link you've just shared. But over to you, Roderick, for your closing remarks as we wrap up. Thank you very much, ladies and gentlemen, for joining. Over to you, Roderick.
Hello, hi everyone. Sorry if I joined late because I had some other engagement, but because of the last session that I had been moderated by the last session around the discussion with partners, I think it was really great. And I don't want to repeat what Glory has mentioned around the role of IANASO as a host of the Learning Hub, but just to say that based on the needs assessment and the feedback that we received, it will help us to shape on how we are going to engage with you starting from next year. And as we approach toward the end of the year, we have already started planning on how we do integrate these some of these recommendations and feedback into the work that we do, but not just us as a learning hub, but also even the other partners that one way or the other do support communities, not directly from IANASO, but they will also be able to use that report to inform their programs and the kind of support that they provide. So we hope to submit it widely to the constituencies and or the donors and partners so that they can be able to have a look and also appreciate that the feedback from the communities. So thank you very much for your time. I know it's late, but I really appreciate your time for being here up to this time. And I wish you a great day. Looking to see you in our future webinars like this. Thank you.
Perfect. Thank you, ladies and gentlemen. Do have a great afternoon, a great morning, depending on how or where you joined. Thank you, ladies and gentlemen. Thank you for the speakers. We extend our gratitude and look forward to more engagement as we near the end of the year. Thank you all. Have a great one.
Thank you, Liz.
Thank you, Liz. Bye.
Bye.
Hello, colleagues. Lizzie and the others, if you
Yes,
don't mind, please.
Uncle.
If you don't mind, please, will you be able to share with us partners who provide TA directly to the community?